Welcome back to PHAMCAST. This is the third segment, but you know, it always goes too quick when we have Dr. Teske in the house because I love learning from her, and I know you do too. And what I love about having conversations with Dr. Teske is because she's a lifelong learner herself, and she loves to learn from others. And that's why it's so cool. How humbling is it as a massage therapist to actually have worked right inside an optometry office? Not too many optometrists are open to even the idea of that, let alone executing it and then learning from one another. But we did that together.
We sure did.
That is really, really cool because it really is talk about breaking down silos and really working better together with one mission in mind, which is to improve the health and well-being of the people we have the privilege of treating. And I love that because I love thinking outside the box, and you and I for years have been thinking that way to try to see, because our goal is to help whoever we're treating and how that can be. So one of the commonalities between our professions and most healthcare is this thing called the nervous system and stress, right? And people take for granted stress is in our lives every day. And there's different types of stressors. There's emotional stressors, there's physical stressors, there are environmental stressors. But the nervous system reacts to all of it. And this whole thing called cortisol, the stress hormone that can have a massive impact on every system of the body, including your eyes. Well, as a massage therapist, I'm always on a quest to downregulate the nervous system, to put you into parasympathetics, or that rest and digest, that healing state, especially in a world when we're living in fight and flight all the time, constantly overwhelmed. And our systems, we wonder why we have disease. What's been really cool, I would love to talk now, Dr. Teske, about some of the work that we've started and have so much more work to do, which we're excited about. And looking at the nervous system and the way it connects with eyes, and a tool that I introduced you to, which was called the Dolphin Microcurrent. So microcurrent point stimulation therapy, which is really taking needleless acupuncture, the principles of needless acupuncture, and microcurrent, direct current, which is different than a typical TENS machine, and actually using that to impact eye health. Let's talk about the study that we had started with on microcurrent and the really exciting things that we were seeing preliminary and the work we want to continue to do.
For sure. So as you had introduced me to Dolphin, I was aware of the potential powerful side effects or impact that microcurrent has. I was attending a vision therapy lecture.
Yes, you were.
And I remember texting you madly and saying, they're talking about microcurrent to treat amblyopia or a lazy eye. What do you think? Is this the same microcurrent? Can we put these two technologies together? Because of course, Dolphin is handheld and patient empowered, right?
Yes.
Versus research in a clinic.
Exactly.
So we invited the lecturer at the time to come and do a study in my clinic with our patients to apply his microcurrent to the brain with great results. Right?
Yes. Yes, and when we say great results, let's talk about what that was. And for those of you at home that don't know what microcurrent point stimulation therapy, or the Dolphin, it's a Health Canada approved device used for home use. I've put it in the hands of hundreds of my patients and people so that they can be using this at home to downregulate the autonomic nervous system for a wide range of things to help with pain and inflammation and all kinds of things. Because when you work the nervous system, you can work everything, including the eyes. Mm-hmm. So let's talk a little bit about what were some of the outcomes we were seeing and why we're getting excited about the role that microcurrent, if it's the right microcurrent done in the right way with the right protocols, how we could have results for other things.
Well, I think, certainly we saw it with respect to applied to the brain for vision, but you witnessed it, and I was here, we were in clinic together when we saw a patient's lacrimal gland function better because you were up-regulating the function of the facial nerve. And, for a patient who had not been crying for years.
So I want for everybody at home, because here's a wonderful optometrist talking about the lacrimal gland, and many of you may not even know what that is. So let's speak to that. What is the lacrimal gland? And I got to tell you, this was unbelievable. I came running down the hallway in your clinic because I'm like, Dr. Teske, you've got to come and see this. I've just treated. Let's talk about, without giving the information about the patient, but what had been going on with her, why you referred her to me, and then the outcome. So lacrimal gland is?
Sure. So, the lacrimal gland is, a structure up here that will, create tears to cover the surface of the eye. So it's one part of the tear system.
Right.
But it's innervated, or it functions better as a result of the facial nerve.
Right.
So the brain tells the facial nerve to tell the lacrimal gland to make tears.
Right.
So in this particular patient's case, there had been damage to the facial nerve because she had a tumor removed.
Correct.
In, her ear area. So again, it's all connected, right?
Totally.
We're working in the ear and we affect the eye.
She had a major scar, so of course because she had been years post-surgical and not able, her eye was open, she couldn't close her eye properly, she wasn't making tears, so she had dry eye, and that was miserable. It was really hard. I can remember her saying to me she couldn't lay down, as all of us. I love when I go to get my hair done and they're massaging your head, but her laying back on that scar was painful. So it wasn't an enjoyable thing. It was impacting her day-to-day life. And it had been 15 years, I think, since the surgery. And of course, coming to see you for treatment of dry eye. You knew about the microcurrent and then referred to me.
Right.
And when I was treating her and doing some protocol with the dolphin and releasing the scar, and then literally in one treatment in front of my eyes, she started to get a tear coming down her face, and her husband was in the room, and he started to tear up because he says, I haven't seen this in 15 years. I was like, I can't believe I just did this. And I wanted to go to you to explain to me, because listen, we understand muscles and nerves and nerve innervation and all the things, but I'm not used to working with eyes to that level. I am now. And I said to you, Dr. Teske, explain this to me. And right away you went, oh my gosh, I'll tell you exactly why. Yeah. We got the facial nerve working.
Right. So cool. Microcurrent, powerful. Right?
Yes.
Powerful. I treat myself with microcurrent most days, every day.
Yep.
Right. And I use, the golden triad to, put myself in that calming place.
Right.
I think all of us at one point or another is going to need the support of other healthcare practitioners or tools or, paths to look forward, which is what FAM's all about.
It is exactly that. And this is why I love having these conversations, because here it is, a massage therapist and optometrist working together and learning from one another, but most importantly, improving the outcomes for the people that we have the privilege of treating. So that's really cool about microcurrent. And we're still, so just heads up, we're looking at doing more research because there needs to be more work done. And we know that we can see changes. And as you were mentioning, the dolphin is something people can be using at home. So imagine outside of your office when you can empower everyday people, your patients, to use this at home, helping with dry eye, not just amblyopia, but dry eye and other eye
many
conditions.
Other, right?
Yeah.
Chronic pain everywhere, right? Sciatica,
Totally.
Headache, anxiety.
Anxiety
right?
is a big
Stress, mental health. Right?
Yeah, and I think in anxiety is stress. I think that's a good segue to now talk about, because people probably don't think about this in eye health. And another thing I've learned from you is the whole idea of the impact of stress and mental health and the eye, and a solution you have here that you've been trained in. Can you speak to something that you're doing here that, believe it or not, people that are having anxiety and depression come in to be treated for? Can you talk to that technology?
For sure. So, again, if you're holistic in your approach and you think about the eyes as an extension to the brain, then you can use the eyes as an input to the brain to reset the brain. Right? So syntonics, or light therapy, is one of the tools that we offer here. I think probably the most, easiest way to explain it is without having the patient need to do anything other than show up.
Right.
We can determine what wavelength of light will help support their wellness and reset their nervous system to a healing place. So it's pretty cool.
It's very cool. And it's also been very effective in children. Can you explain how that's been effective too?
For sure. I think we discount the impact of, overactive nervous system with kids, right? I don't think I've really felt it myself even until you're in a calmer state. You don't realize how wired you are.
Totally. Right? Yep, the whole wired but yet tired, like we're constantly like this. But when we downregulate that nervous system, all of a sudden you're in that parasympathetic mode. The world appears differently in so many levels, which is incredible.
For sure.
So syntonics, and of course, as a behavioral optometrist, not every optometrist has the ability to do syntonics, correct? Can you explain a little bit about that? So if anybody's looking for that kind of service?
Yeah, absolutely. Behavioral optometry is really treating the eyes not only as, an isolated organ, but looking at the eyes as an input to the brain. And then really, treating the visual system as that whole circuit, even from fascia in the brain, from, the circulation in the head and neck, from traumatic brain injury impact. Concussion, indeed, for sure, right? So you really have to look at the brain and the eyes and the body as a whole. You could have an osteopath involved at realigning neck and spine, a chiropractor, a massage therapist, lymphatic drainage, like really there is a place for all of us.
Absolutely. A hormonal specialist, a nutritionist. We all have a place at the table because we all are going to impact the outcome. So dry eye, you made mention, we were talking about the impact that dry eye can have on, and prevention, things like falls and proprioception and even just quality of life. Because when people have real dry eye, it can impact, if you love to read, you don't want to read, or, there's a lot of things that can impact. There's some advances, you're saying, that I'd love to talk about a little bit about dry eye and finding out what's available and what people can do to help themselves.
Sure. So, often we talked about the lacrimal gland a while ago. So that is the water part of your tears. So there's two parts to your tears. Oil first, that holds the water in there, and then the water. The oil is made by the glands along the lids and lashes.
Okay.
So really, to properly treat dry eye, you have to treat the lids and help support the gland and add drops. So often people will come in and say, well, my eyes are weeping all the time. How could they possibly be dry?
Oh, that's true, yeah.
But it is not. It truly still is a dry eye. It's because the oil's not holding the water in there. So one of the newer concepts, is using what we call IPL, which is intense pulse laser. So it is a light that helps open up the glands along the lids and lashes to make the oils work better and hold the water that you do make stay in longer.
Amazing. Now, I know members in my family and as a massage therapist and trained in hydrotherapy and the use of heat. Talk a little bit about those eye masks and the role that they can play. Because I'm always looking, FAM is about stocking their toolbox and what can they do at home, preventatively and otherwise, to improve their health and well-being and be the CEO of their health. What about those eye masks?
For sure. So we now know, because we've done enough research, that you need to have heat, wet, moist heat, 30 degrees at least 5 minutes to help these glands drain. So you can't really do that with a face cloth.
No.
There's no possible way to do that. So that's what the mask does. So you heat it and then 5 minutes on your eyes. I like to call it like the spa for your eyelids.
Right.
So that truly is addressing the lid component. So I would call that like maintenance plan, right?
Right.
So that you can do that more regularly to avoid having that dryness.
For both of the matriarchs in our family, my mother and my mother-in-law, both struggling with dry eye, and of course always looking for, especially my mom, looking for proactive ways to help. And I don't know if you've seen this, Dr. Teske, but it's actually a mask that it charges so that you don't, because one of the things that, of course, you've warned people about, be careful when you put something in the microwave that you don't burn yourself and all of the things, but it's been unbelievably helpful because it's on a timer. So you put it on, you plug it in, then you put it on, you put the timer on, and when it's done, it's done. What a difference preventatively it's been making.
Nice.
So that's kind of cool as well. Sure. Okay, and we've only got a few minutes left here. So there's a plethora of drops. And I know, there's different reasons for different types of drops, the application of it. Can you just give a little bit of when we're talking about dry eye or even prevention, what are we looking for? Because I know there's gels and there's just drops and there's, so can you...
And ointments.
Yeah, can you get just some of that confusion out of the way so people understand?
I think my goal always is to have the patient do the least amount of work for the biggest benefit. Because if most people are like me, and I think we are all similar, if it requires a lot of effort, it's not going to happen.
Totally.
So I would prefer to use a better drop that's going to last longer.
Totally.
So that you don't have to instill it as often. And there are a host of drops out there. We don't want preservatives. We probably want something with hyaluronate in it, which is the anti-inflammatory component. That'll make it last longer.
Okay.
Now, depending on the severity of the dry eye, you can have that in an ointment or you can have it in a gel. which of course would be applied only at bed because then, the vision is blurred.
Right.
But we definitely want to invest in a better drop, not an eye whitener that is just going to take the red away.
Right.
But we definitely want to be sure that the drop that you're using is going to be effective and not have to be used too often.
Right. Good. So before we finish up, I think that it's really important. We want to give as many resources as possible. And I am super proud, as are you, of the not one, but two series we did on eye health that we shared years ago that are still getting views to this day. One was all about seniors in eye care, which we're both very, very passionate about. And one was about cataracts. Can you speak to some of the professionals that we've had the collaboration with, like the Dr. Ike Ahmed, and that are in your circle? Because I want people to know that how proud am I to be partnering, with a FAMCAST like you, Dr. Teske, that's also connected to a broader network. And that's what this FAM mission's about. It's not just about having one optometrist. It's about having many optometrists or ophthalmologists just to join the family, join this movement. Let's talk about that series and who we brought to the table, because it was impressive.
For sure. We had the pleasure of really interviewing and speaking with educators,
yes.
right? So Dr. Ike Ahmed, he's the king of glaucoma. In fact, recently was honored top ophthalmologist in the world out of 100. So,
and he was on our series. That is so cool.
Was. And, he's such a humble, but such a clever and gifted professional who really, sort of roots wants to educate patients,
yes.
right? The same passion that we share. So he agreed to join the series. Dr. Dean Smith,
yes.
Cataract surgeon. I really hope he stays working long enough to deal with my eyes when it's time.
And me too.
But, again, highest caliber surgeon, but knows his patients, takes the time to educate.
And allowed me to come in to the OR and actually watch a cataract and bring the cameras in. Mm-hmm. That was really cool. Yeah, what a privilege. And thanks to you, we've been able to bring these types of caliber of people to the table. And Dr. Shirley Haw, there's been so many, and there will be more. So if you're watching and maybe you are in the, you're an optometrist and you want to join the family, take Dr. Teske's lead. This is a movement that's going to change the legacy of healthcare, but we all need to be part of the solution, and we all need to be ensuring that we can educate and empower everyday people to become the CEO of your health. Thank you, Dr. Teske. I learn from you every single time, and I'm honored that not only that you're a FAMCAST, I'm lucky that you're my optometrist, and I'm privileged that you're my friend.
Thanks for having me, Mark. Always a pleasure.
You betcha. So that's it here on Eyes Are a Window to Your Health Day during Preventative Health Awareness Month and Movement. Follow us, join the family, look at the blog, check out the YouTube channel, do all the things, because we are committed to helping stock your toolbox. And if you like what you saw here today, share it with others. Until next time, remember, a healthy tomorrow begins with prevention today. We'll see you all soon.